Hello, everyone. Welcome to the Briotix Health Spotlight, where we speak providers, subject matter experts, and other key players in the field about the various aspects of worker wellness that are affecting you and your company today. On-site clinical solutions are an evolving step in the field of worker health, but they can also be an expensive initial investment. So it makes you wonder, what are the real benefits and how do you approach implementation of these incredibly useful techniques? We are joined today by Suzann Vincent, Director of Account Development at Briotix Health, to discuss the current approaches to clinical solutions and the unique benefits to employers and employees. Suzann, welcome to the Spotlight, and thank you so much for joining us today.
Thank you. Excited to be here.
I'd love to start off by just learning a little bit more about you. Can you tell us more about yourself and your background in clinical solutions?
Sure. Well, let's just say a long time, a decade or two, I've been on the provider side of occupational health. Whether I'm inspiring our internal teams, to innovate, or an employer to implement one of our strategies, I just love working in the field, surrounded by people that work hard to keep workers healthy and safe. There's a regulatory side of occupational health, a check the box of sorts, but there's a side of occupational health full of enthusiasm and passion for prevention. And I have to say that's the fun part of my job.
Jumping into kind of the topic here and learning a little bit more about clinical solutions, at Briotix Health, we often recommend a comprehensive approach to employee care. How do clinical solutions help facilitate that approach?
That's a good question. Well, just like no two employees are the same, the science, the practice of occupational health involves several disciplines, such as occupational medicine, ergonomics, psychology, hygiene, surveillance, safety. It touches the employee from hiring to even beyond retiring, if you count the record keeping aspect. So when an employee, it all starts when they select their best candidate. Is the job description current? Is it accurate? Can the employee safely perform the job? Does the employee need a reasonable accommodation to do the job safely? A 5'4" worker will have a different setup than a 6'4" worker. Is the work site noisy? A baseline of the worker's hearing should be established to screen regularly for noise exposure. Does the employee need training to safely do their job? Just like an athlete adjusts their equipment and they wear protective gear, they stretch, they condition, the industrial athlete should be educated on how to stay safe in the game. Is the worker ready for work each and every day when the clock resets? Sleep deprivation, drugs, alcohol, depression, distraction. What if an injury occurs? So to meet that employee's needs, our solutions need to be comprehensive. They need to be delivered by experts, accessible, immediate, and ideally near or at the work site.
So this leads directly into our next question about, being near the worksite, being in the worksite for the best result. What are the primary benefits of choosing an on-site clinic over using off-site clinics?
Well, they both serve their purpose. Really, the prospect of an on-site clinic at an employer site is exciting when it makes sense. Are there enough employees at the location? Is there space, like an empty office or an existing first aid room? Questions like, what kind of testing and surveillance is the employer required to perform? What does the historical injury data show? Is there access to near site services? Will the new hire candidate be able to access the clinic? Establishing the employer's goals for the program is super important. Besides the obvious financial analysis, it's really important to measure the impact of convenience and proximity to care. An on-site clinic facilitates immediate care, but it also keeps the employee close to the work site versus the complexities of accessing care off-site, which, there could be traffic, it could be far away, the care can be inconsistent. It's not always specialized for occupational care. And we all know there can be super long wait times. So again, there's a certain evaluation process to see if it makes sense for that employer and that employer's location.
So I feel like we've heard a lot about the employer there. Shifting to the employee, what can an employee expect in their first visit to an on-site clinic? And what about repeat visits after that?
Ideally, it all starts when you're a candidate. You can visit the clinic for a post-offer employment strength test, a post-offer drug screen, and then once hired, you may be scheduled at the clinic to visit with an occupational health provider, anywhere from an industrial sports medicine provider, a nurse. They all facilitate things like new hire training, ergonomic consultation, medical surveillance, such as those hearing tests we were talking about, respirator fittings. The list goes on. If an employer uses a wellness app, it's a great opportunity to help the employee log on and get some instruction on how to use the app. They may even have a wellness visit while they're there. And then annually or as scheduled, the employee may return for that wellness visit. I like to call them birthday visits, a hearing check, or maybe they have some on-the-job discomfort or they've experienced an injury. Those are all reasons that you would go to access care at the clinic.
Yeah. If a company or an individual is thinking about implementing clinical solutions in their workplace, what are next steps they should consider?
Oh gosh, implementing a new clinic or updating an outdated first aid room is super exciting. Typically, the clients, EHS, their environmental health and safety, and their human resources department initiate the project. They establish a budget, they get maybe the C-suite approval. And then, we've already discussed the need to establish short and long-term goals for the program, but the on-site services can be implemented at any size client, really depending on those services, the location, the requirements. The discovery process should really include an understanding and comparing the cost and convenience and the access of services to be administered off-site versus on-site to determine that good fit and if it makes sense for that employer and that location. The fun part's selecting a vendor partner, that will bring the clinical expertise, the consultative approach to the project. I know our success at Briotix hinges on nurturing close relationships with our clients that stand the test of time. We're proud to have partnered with some of the world's most recognized organizations in implementing and servicing their program.
How does Briotix kind of jump in and help in that process of setting up, implementing on-site clinic, anything like that?
Yeah, good question. Briotix, we've grown through mergers and acquisitions and organic growth. Our most recent merger with Atlas IPS joins two teams with, 25 years of experience in helping employers develop injury prevention and clinical solutions, assisting clients across diverse industries in mitigating workplace injury risks. Our mantra, keep it simple, measurable, and cost-effective. So once the teams connect, we help the clients financially evaluate the situation. We look at the appropriate strategy, and then we tailor that program. As a consequence, our solutions have consistently led clients to substantial improvements in worker health.
With all this information, your obvious strong background in clinical solutions, I'd love to hear, in your opinion, what are those top 3 approximately benefits a company could gain from implementing clinical solutions in their workplace?
I only get 3. Well, immediate, consistent access to occupational health experts, a trusted third party to manage the health of their best assets, their employees. And ultimately, I guess number 3 would be, we partner with our clients to keep the employees healthy and safe. The EHS department takes care of the physical space. We take care of the individual, and we allow the employer to focus on their business.
Well, Suzann, thank you so much for coming out today, for joining us, for giving us a little more insight into clinical solutions, your background on them, and this kind of the next steps people could be taking when looking at these. Thank you so much for joining us on the Spotlight, and we hope we'll see you again soon.
It was a pleasure. Thanks for having me.